Imagine two rivers, different in origin, unique in flow, converging into one powerful, complex stream. That's what happens when autism spectrum disorder, ASD, and attention deficit hyperactivity disorder, ADHD, occur together. Two distinct neurodevelopmental conditions, one known for challenges in social communication, the other for difficulties with attention and impulse control, can coexist in the same individual. And when they do, the result is a uniquely wired brain that defies simple labels. In this video, we're diving deep into the science, struggles, strengths, and strategies of co-occurring autism and ADHD, a topic that is gaining recognition and relevance worldwide. Let's begin. Chapter 1. Defining the conditions. What is autism spectrum disorder, ASD? Autism is a neurodevelopmental condition characterized by challenges with social interaction and communication, restricted interests or repetitive behaviors, sensory sensitivities, a preference for structure and routine. It exists on a spectrum, meaning each autistic person may experience symptoms in a unique combination and severity. What is ADHD? ADHD is also a neurodevelopmental disorder defined by inattention, trouble focusing, disorganization, hyperactivity, excess movement, fidgeting, impulsivity, acting without thinking, interrupting others. ADHD often emerges in early childhood but can persist into adulthood. Both autism and ADHD are lifelong, brain-based conditions, and though separate diagnoses, they often appear together in the same child, teen, or adult. Chapter 2. The overlap. Statistics and reality. How often do these conditions coexist? 30 to 80% of individuals with autism also show symptoms of ADHD. Around 20-50% of people with ADHD meet criteria for autism. That's a large overlap. And yet, for decades, diagnostic manuals didn't allow both to be diagnosed in the same person. It wasn't until the DSM-5 released in 2013 that clinicians could officially diagnose autism and ADHD together. Before that, many were misdiagnosed or underdiagnosed. Now we know better. Now we recognize that brains don't fit neatly into boxes. Chapter 3. Why do autism and ADHD co-occur? The exact reason isn't fully understood, but research suggests 1. Shared genetic roots. Both conditions run in families. Twin studies show strong heritability. Some gene variants appear to increase the risk of both autism and ADHD. 2. Brain function similarities. Both involve differences in executive functioning, attention regulation, and sensory processing. Neuroimaging shows overlapping patterns in brain structure and connectivity, especially in the prefrontal cortex and dopaminergic systems. 3. Developmental timing. Symptoms of both often emerge in early childhood, making diagnosis tricky and often delayed. In short, they are distinct but related conditions, cousins in the neurodevelopmental family. Chapter 4. What it looks like. A closer view. Let's meet Liam, age 10. Liam was diagnosed with ADHD at age 6. He's energetic, impulsive, and distractible. But teachers also noticed he doesn't play easily with other children. He doesn't understand sarcasm. He fixates on trains and struggles with changes in routine. A deeper evaluation revealed autism. And suddenly, the pieces of the puzzle started to fit. When autism and ADHD occur together, we may see extreme difficulty shifting attention, more than typical ADHD, trouble interpreting social cues, and focusing on tasks, meltdowns triggered by sensory overload and frustration, disorganization plus rigid routines, high verbal skills, but poor social reciprocity, deep focus, hyperfocus that can appear as distractibility or brilliance. This is not a double disorder, it's a dual identity, and it's often misunderstood. Chapter 5. Differences that matter. Let's break down how autism and ADHD differ and overlap. Feature autism, ADHD, both social skills, struggles with reciprocity, eye contact, may interrupt or blurt out, awkwardness, difficulty with peers, focus, may hyperfocus on interests, easily distracted, trouble with attention shifts, routines, rigid, needs sameness, impulsive, may dislike routine, may struggle to follow structure, sensory sensitivity, very common, less common. Both may be overwhelmed by noise, textures, communication style, literal, monotone, formal talks excessively or impulsively, atypical patterns in speech and expression. Understanding these differences is key to accurate diagnosis and effective treatment. Chapter 6. Challenges of dual diagnosis. Having both autism and ADHD can amplify challenges, especially in 1. School. Difficulty sitting still, focusing, understanding instructions. Troublemaking and keeping friends. Misunderstood behaviors, seen as lazy, defiant, or disobedient. 2. Home. Daily routines can be chaotic. Sensory issues and impulsivity may lead to meltdowns. Parents may feel overwhelmed, especially without support. 3. Mental health. Increased risk of anxiety, depression, and low self-esteem. Higher chance of being bullied or socially excluded. Emotional dysregulations, intense reactions to everyday situations. These are not bad kids. They're kids with unmet neurological needs. Chapter 7. Strengths of neurodivergent minds. It's easy to focus on struggles, but these kids and adults also have incredible strengths: creativity and outside-the-box thinking, hyper-focus on areas of interest, strong memory, especially for facts and systems, honesty and loyalty. A unique way of seeing the world. Some of history's most innovative minds, from Thomas Edison to Temple Grandin, may have had traits of both autism and ADHD. Neurodivergence isn't a disorder, it's a difference. Chapter 8. How to support and treat. Treating co-occurring autism and ADHD requires a multidisciplinary, personalized approach. 1. Medication. Stimulants, like methylphenidate, are often used for ADHD symptoms, but may cause more side effects in autistic individuals, e.g., anxiety, irritability. Non-stimulants like atomoxetine or guanfacine may be better tolerated. Medication must be tailored carefully. What helps one may overstimulate another. 2. Behavioral therapies, applied behavior analysis, ABA, often used in autism, but controversial, should always be compassionate and child-centered. Cognitive behavioral therapy, CBT, adapted for both conditions to help with anxiety, organization, and emotional regulation. Social skills training, group or individual sessions to practice communication and friendships. Occupational therapy, OT, for sensory integration and motor coordination. 3. Educational accommodations, IEP or 504 plans in schools. Breaks, fidget tools, reduced homework, visual supports, flexible seating, special education services if needed. 4. Parent and family support, training in positive behavior support, joining parent support groups, self-care for caregivers, it's essential. Chapter 9. Teens and adults. It doesn't end in childhood. Many teens and adults go undiagnosed, especially women, people of color, and those with milder presentations. They may grow up feeling different, struggling with relationships, organization, and identity, but never understanding why. Late diagnosis can be liberating. It brings answers, it reframes the past, it allows individuals to forgive themselves for things that weren't their fault. Life with autism and ADHD doesn't stop at 18. The brain matures, but support is still needed in work, college, and relationships. Chapter 10. Misconceptions to unlearn. Let's bust some myths. They just need more discipline. Neurological differences aren't corrected with punishment. Autism and ADHD cancel each other out. They interact, often intensifying symptoms. They can't live independently. With support, many thrive in careers, relationships, and adulthood. It's overdiagnosed these days. We're finally recognizing what was always there. Language matters. Labels matter, not to define people, but to empower them. Ending. A message of hope and understanding. When autism and ADHD occur together, life can be chaotic, challenging, and yes, beautiful. These minds are not broken. They're brilliant in ways the world is just starting to understand. Let us shift the narrative from deficit to diversity. Let us see the person, not just the diagnosis, and let us remember, in every overstimulated child, every misunderstood teen, every distracted adult, there is potential, there is humanity, there is hope. Thank you for listening. Thank you for caring.